Welcome to Breakthrough Barriers with Damali. I'm your host, Damali Peterman. On this podcast, we invite you to share a conflict that you need help navigating, and I, along with a guest co-host, will share what we would do in that situation to help you reach your breakthrough. Welcome to the show. On today's episode, I am overjoyed to have Dr. Rosemarie Ingleton. You must know who she is. Rose, thank you for being here.
This is wonderful. Thank you for having me, Damali.
Oh, I'm so excited. You know, Rose, I'm going to let you tell them about you, but I have to tell them about you first because you are just so incredible. You're a wonderful person, friend, sister, and you just happen to be, kind of dermatologist to the stars. I'm just going to put it out there.
Okay, I'm your friend. You're just biased.
I'm definitely biased, but I also have seen you on The Doctor Show, Good Morning America. Maybe got a sneak preview of an upcoming article in the Oprah magazine.
Yeah, okay.
That doesn't happen to everyone.
You got me.
I mean, I'm biased, but I have evidence. I have receipts, Rose. I have receipts.
Damn, I can't say a thing. Okay, I feel the love.
Oh, so much love for you, Rose. You are just an inspiration and just a wonderful, amazing person. Like that smile, the warmth. I mean, I don't know how people are just like following me all over the streets here in New York City.
Oh, that was funny just now. I told you that story.
Yes, that's wild.
Walking over here with my sunglasses on, thinking I'm just incognito. Hey, Rose!
And you're like, who's that? How they
Random
know?
people running over.
Well, Rose, when you have such a wonderful presence, how can people not be drawn to you like a magnet?
I love it.
It's just the truth. So, Rose, tell us more about you.
So, first and foremost, I'm a mom. I'm Elaine's daughter. I like to tell everybody that my mom is 93 years old and such a rock star. She's like, does everything. So I like to say I'm her daughter. But along the way, I became a dermatologist. And, it started off, with me being an internal medicine physician who became then secondarily trained to become a dermatologist. And I built what has become quite a practice over the last 20 years, right in Lower Manhattan.
Wow.
I love that it's like super varied, the kind of people I see, the kinds of diseases, the age groups, the races, people from everywhere in the world come. And it's so exciting to go to work.
Oh, and they love you, Rose. I mean, I've been fortunate to visit your practice, and I mean, what a fan club.
It's so fun to work there.
You make skin fun. Let me tell you. That's
what?
our new motto.
I make skin fun.
You make skin fun.
I like it. I like it. I make sure that people feel very, very comfortable.
You do. Everything from start to finish is just so welcoming. And I have to tell people how I met you. Okay. It was so random. We met at a birthday party for a child, and this is before I had children. And someone said, you have to meet Rose. You play tennis? Rose plays tennis too.
Yeah, right.
Right? Remember that?
We play tennis at about the same level, right?
Yeah.
Both learning, super interested.
And we've been doing that for about a decade, right? Over a decade.
Yes.
It's so sad.
And along the way, I realized that we are the same person.
We are the same person.
In so many ways.
It's insane.
So crazy.
I look at you and I'm just like, I'm so honored, first of all, to be you, but also just like, thank God for having all these different people out here who we can emulate and aspire to be and having our circle of trust and friends.
I love it.
Right?
Thank you for taking care of me all this time.
Oh, Rose, it's likewise. This is a love fest. I mean, we can keep this love fest
People are
going.
gonna be like, shut up.
Well, the cool thing is, like, I love the podcast format because it's like we're having a conversation and then all those awesome listeners are just kind of eavesdropping on this conversation. But they're welcome to
I know,
tune
right?
in.
They're privy to some private stuff.
Yeah, and I mean, we have Dr. Rosemarie Ingleton in the studio.
What?
I mean, like, I wish you could see my breakdance right now. Breakdance. And I don't breakdance often. I mean, it has to be a special event to breakdance.
All right, then.
And you've seen me breakdance in a few different countries.
Yes, ma'am.
Just putting it out there.
Yes, ma'am, I have.
So for Rose, for people who don't know what we do, I want to tell them about the format of the show. Mm-hmm. And so basically we have this hotline where callers can call in and ask a question. And we don't limit what the question can be about. It can be about a situation that they're pondering. Mm-hmm. It could be about a conflict that they're having. The point of it is just to have some insight from people who aren't in the situation. I mean, think about it. Having a third party neutral couple of people, you and I, to just kind of say, oh, well, if we were in the situation, we would do X, Y, and Z.
Okay.
And so it's kind of cool. So for those of you who are listening in, what will happen in a few moments is we're going to play a call or two that we've received in our hotline. Rose has not heard the call before. We're going to play it for the first time. We'll listen to it, and then we're just going to give our thoughts on it.
Oh, very good. I think I can do this.
I know you can do it.
So open and just like, I really don't know
Yeah, I
a
love
lot
it.
about what we're doing today, but I'm so open and you're my friend. I trust you. So how bad could it be?
It's going to be awesome. The opposite of bad. It's going to be excellent.
awesome.
It's going to be awesome.
Right? Okay.
Well, the cool thing about it is what I found doing these podcasts is that, I tested it out before we kind of went into this format, and it's always better. A person's first reaction to it is always better, right? And so
agree.
that's what I want. I want if someone called you up on the phone and said, Rose, this is what's going on. What do you think? It's kind of like that, like how I do.
That does happen. Exactly.
It happens all the time. And so that's kind of how the idea was born. And so without further ado, let's play our first message.
You have one message.
Hey, Damali. My name is Lorraine, and I'm calling in because lately I've been dealing with a lot of acne problems. My face has a lot of acne scars and a lot of acne, which makes me really uncomfortable. So I was wondering if you happen to know, first of all, any tips to keep acne under control, just any quick tips that I could use. And also, I was wondering if you had any tips for regaining confidence, because this is something that has made me kind of insecure. And I was just wondering if you knew any ways where I could not let the acne affect the way I present myself to people. Thank you.
Ooh.
This is right up my alley.
Well, fortunately, she added some things that weren't acne related that I can kind of opine on, because this is going to be all you, Rose. And so I heard 3 questions. One was about the acne and how to maybe keep it under control.
Right.
The second one was about regaining confidence that she lost due to the acne. And then the third question was, how can I not let this acne affect the way that I present myself to people?
Wow. This is like what I do all day long.
Wow.
If I were to choose the most common condition that I'm asked to help with, it's acne.
Really?
And the result of, the sequelae, as we say, the things that come as a result of having had acne. So scarring, discoloration, and just loss of confidence.
Yeah.
All the things that she hit on.
Oh, wow. This is amazing. And this was not planned. So this is fantastic.
Really, this is like, I felt like she came to my office. Like she knew Dr. Ingleton was going to be here.
Dr. Ingleton's in the building, folks.
And can I just tell you, when I walk into the room and I have a patient who has acne, the worse the case looks, the more excited I get.
You are in the right field, because I would run out of that room.
No, I'm like, oh my God, I can so see the end point, see how I can fix them.
You are
so,
good.
In answer to her question, I don't have any information about whether she's tried anything at home. Typically, before people come in to see me, they would have tried either some TV products, or they would have tried the things that are in the drugstore. And the types of products that you get in those arenas are very limited. It's the same ingredients over and over, just repackaged. But when you come to the dermatologist, when you come to me anyway, I am very nosy. I ask a whole lot of questions. So my patients are really shocked. They're a little taken aback that I'm asking them to tell me everything they do at home. What do you use? I want to know the names of the products. Do you wash your face at night before you go to bed? Do you wear makeup? Which one do you wear? Or do you take birth control tablets? Are you, on hormone therapy for something? I ask a whole lot of questions.
You want to know everything, Rose.
Yeah, because then I get a sense of who I'm really dealing with.
Okay.
Not everybody's situation is the same, and how they came to have acne is not the same. Many people, it's their makeup choices, the foundation's full of oil.
Oh, yeah.
Especially if you have skin of color. A lot of the products, once they say skin of color, it automatically in the companies that make these products, they think we want heavy, oily products. Not the case. That's just going to lend to acne. I also ask about hair care, because now with the natural hair movement, a lot of products have coconut oil, olive oil, any kind of oil. Those are the worst things for the face. So I want to, I ask a lot of questions, but just generically speaking for her, I would say some of the tips that I would recommend for you are to make sure that you are at least cleansing your face, because as basic as that sounds, some people just don't wash their faces. They either just do water or they don't wash their faces at all. They sleep in their makeup. These are big no-nos. if you are using products on your hair, you want to be careful to avoid products that, even though they make your hair look nice and shiny and curly or straight, whatever way you wear your hair, that they're not heavy oils. There's a word in our dermatology world that's called comedogenic, where it means it clogs pores. So when you buy products, whether it's for your hair or your face, look on the package and make sure it's non-comedogenic.
Non-comedogenic. Ooh,
It means that it doesn't block up the pores and cause more acne to form. So, check your hair products. And similarly with your makeup products, your foundation, your powder, don't buy products that are for stage. You're not, unless you're a stage star, but just the regular person going back and forth to work or school every day. You do not need pancake makeup because, inherently those products have heavy ingredients that are going to create more acne. So a little bit of that kind of background work. Without a dermatologist, you're kind of stuck trying things, from the drugstore, which are usually benzoyl peroxide and salicylic acid. These are very common ingredients that are available over the counter. If you're not getting anywhere with those and it's been like 3 months, you may want to just see a dermatologist to get that addressed, because we have access to a myriad of products and ingredients that you don't have over the counter. You'll need prescriptions for. And of course, once you clear the acne up, a lot of times the discoloration or the scarring is really what people are bummed out about, because that's what the world sees, right? You see the face first.
Yeah.
In my practice, I do a lot of work with, chemical peels. And first, educating people about what chemical peels are and not to be scared of them. Make sure you have a professional doing it, a dermatologist, preferably. Not
me.
Not just
me.
a spa. No, don't go to Damali's house.
No, I don't do that.
But, get a professional to do it, because they really can change your life if they're done properly. There are lasers that are available that are fair, fine for all skin colors. There are there's microneedling. There are like all these procedures, microdermabrasion. So there's technology out there that can help you to correct any of the discoloration or scars that will ultimately affect your confidence even after the acne has been cleared up. So definitely explore that with your dermatologist. And then what was the last question? It was about presenting.
About not letting the acne affect the way she presents herself to people.
Okay. Well, I'm sure that emotionally you're affected by it when the acne is present. So the way to prevent this from getting in the way is to really just address it, but address it with a professional, a dermatologist, preferably somebody who's board certified, so they can get you clear. There's so many options. It's like, so, I can probably say there's never been someone that I've seen with acne that I've not been able to help.
Wow, that's amazing, Rose.
Yeah, even if it means going to the end point. For me, that last straw is isotretinoin or Accutane that you've probably heard about.
What's that?
It is an oral medication. I consider it my last resort.
Okay.
It is vitamin A based, but because it is vitamin A based, there are risks to women who might get pregnant.
Okay.
So if you're on it, the biggest rule is do not consider even thinking about getting pregnant while you're on it.
I see.
Because it will absolutely affect a baby.
I see.
So it's like a pact. The doctor and the patient go, you have to sign a consent form.
Oh, wow.
Talk about the risks and all the benefits. Well, benefits, of course, but the risks. That is the most worrisome potential side effect. But otherwise, it just causes a lot of dryness, like your lips will be dry, your skin will be dry. But I tell my patients, don't worry, I got you. I've got, all kinds of products I can recommend for that. You have to have a normal liver because it clears out of your body through your liver. So we'll do blood testing to check. But it's miraculous. It really is. I mean, for people who have the most deforming, horrible cases of acne, though, that's a drug that can change their lives.
Okay.
But I leave it as my last resort. It's not the first thing I'm going to discuss with you when you come in and you have 10 pimples,
Yeah.
I'm going to try some of the other things. And we have a lot of things that we try before we get to that point. But I can't think of anybody I've never been able to help.
Wow,
if they
Rose.
allow me.
Of course. And they have to listen to all the things that you said, right?
Yeah.
And so you have to change perhaps some habits that you may have. You may have to change some of your products for your face, for your hair.
Yeah.
You may have to start reading labels to make sure it's
Comedogenic.
Thank you. I'm going to be an honorary dermatologist after this. Non-comedogenic. I'm going to walk around and say, is that non-comedogenic?
Oh, right.
Do you know what that means?
I tell my patients to ask that when they go to the makeup counters, in
Ooh.
Bloomingdale's or Macy's or wherever.
Yeah.
I don't know if the workers there are going to know the word, but
they'll
they
know
should.
afterwards. They'll know afterwards. Now I know. Now I will ask the
That's
question.
right. Or flip the bottle around and look at
and
the
look
back.
for it. Now I'm going to start checking because
really-
it's the more you know, right?
The more you know.
Well, what I like about what you said, Rose, and there were so many gems and jewels, and I hope that everyone's writing these down because, you provided such wonderful insight and information that I think regardless of what your stage is with, acne, there's something you can take away from it. So thank you so much for that.
You're so welcome.
It's so amazing.
It's an area of special interest to me.
Well, this is good. And I
Yeah.
love the fact that you stand behind it. You said, look, that there are many ways that we can get this done. And that I know from the basic to my last resort.
Yeah.
And so I love that.
And then all the cosmetic enhancements that can be done to deal with the sequelae, whatever comes after you've cleared the acne. Because my patients are a trip. They're like, yeah, okay, I know. Okay. We got the pimples controlled. I'm not breaking out anymore, but I'm still not happy. And then we talk about that part.
So they're like phases, right?
Yes.
So what I love about it too is that you're focusing on ways to help her to address the problem.
Exactly.
And then after you have that under control, what's next is that confidence factor. Right. And that's where I think I can kind of add to what you said, because I think part of confidence is a feeling. Right. And yeah, there are things that can make you feel more confident or less confident, but it's something that I think you can control, right?
Exactly.
It's not like someone gives you confidence, right? Or no one should be able to give you confidence, right? And so part of what it is if there's something that's making you feel less confident, then once you've have that under control, focus on things that make you feel confident. Is it, something that you're wearing? Is it a way that you style your hair? Is it listening to a song that you love that gets you kind of in the mood and kind of gets you hyped, right? When I was in law school, I used to play this song on repeat over and over again. It was Who's That Girl by Eve. That song would get me hyped for taking an exam.
Can we have a little?
Who's that girl? Na, 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 na. Eve's that girl. And I would always put in my name, like, Damali's that girl.
I love it.
Yeah, but it would get me excited and it would make me feel confident to walk into an exam. Now, of course, before then, I'd studied for the exam. I was prepared. I, of course, went to classes. But it was something about that song that really put me in the right mindset. And so my challenge to you is, Lorraine, is to think about other ways to enhance your confidence. What else can you do that's within your control? So as you're resolving the problem, as Rose, Dr. Ingleton has provided some potential options for you. And it sounds like at the end of the day, you should partner with a dermatologist, right?
Sounds like
of course, she doesn't know you. She hasn't seen your face. She doesn't know what your situation is to clearly diagnose you over a podcast. But the point is that when you partner with someone like Rose, then you really have a partner in this together who's going to help you and try to figure out how to stop whatever's triggering the acne. And then for everything that's, the sequel, you said? Oh, I'm going to be so good when I come out of here with
Big
all
words.
this vocabulary.
Big legal words.
So good. But what's amazing is that then you start thinking about things that you can control, things that you can do to make you feel more confident. And then to me, if you find that acne is affecting the way that you present to people, I would ask you, and if you think that's coming across in a negative way, I would ask you, what can you do to come across in a positive way? What other things do you have control over? So is it, the way that you engage people? If you think that they're focusing on your acne, I assure you they probably aren't. But once we're in our heads and we're thinking something, it's hard to shake that. And so maybe redirect their attention to something else. Right? Maybe, have more conversations about something you have in common so that you're focusing on a topic or a subject and not on each other. I know that may sound strange, but there are a lot of ways to redirect or distract when having a conversation. Trust me, I do it all the time. I do it all the time. People ask me a question and I do exactly what you did. I may laugh and giggle, and instead of answering the question, I ask them a question. And people love to talk. And so once they kind of get in their minds, they're looking at you, but you kind of see their eyes go up and they're thinking of something, and they may not be focusing on the acne. And by the way, some people have pretty poor eyesight, right? So what you may think is presenting as being in their face, you're talking to me. If I don't have my contact lenses in, I only see colors, right? I only see colors. So maybe it's not, we are our own worst critics. And sometimes we like think like the absolute worst about something, and it's probably not that bad, but we're just like, oh, I feel like it's so awful and it's so, egregious. And maybe it's just like not. Maybe to you it's like 100, and to everyone else in the world it's like a 2.
And I take quite a lot of pleasure in when I have a nervous, worried person, especially someone with acne. I give them comparisons, amongst the patients that I've seen, because I see a lot of patients. And I put them, somewhere on the spectrum so they realize you are not the worst case.
Oh, that's good.
And the worst case that I've seen, I was able to fix.
Wow.
So you are not a challenge. If you're just willing to work with me, give me a better understanding of who you are and what you're using and all of that, there's so much available. And if you're committed, right? Because we can give you all the medicines we want. You go home and just like throw them out the window and just lay back and eat cheese pops.
Right.
But if you do it and you develop a relationship with a doctor that you like, I can't imagine that there isn't something that will help.
I like that. I like also that level setting, Rose, like seeing where they fall on the spectrum and then helping them to see that it could be worse.
Oh, so much worse.
Oh, I like that a lot. And so hopefully, Lorraine, that's really helpful. I think we've provided a lot of information. You have information on how to partner with a dermatologist, someone that you like, build a relationship so you can have like this one-on-one conversation and develop, the right treatment plan for you. Also to think about ways to, in the meantime, project confidence or find a source of confidence from something else.
Yeah.
Right? So find that song, find that mindfulness practice, find that friend, find that amazing dress that you look fantastic in, or pants or sneakers, whatever it is, just maybe just for a little bit, just kind of focus on other things. Because I'm sure you got it going on. Right?
She probably does.
I'm sure she's
not focusing on any of that.
I know. She's focusing on like the acne, and I'm sure there's like other things. I'm sure your hair may be amazing.
I was going to say her hair is probably amazing.
Her hair is probably stunning, flowing or short or just like perfect, right?
That's what people see. They look at not just the skin, but they're looking at everything, the whole package.
They're looking at the whole package. So just don't worry about it. And in the meantime, you can call anytime. We want to follow up with you. We want to know how you're doing. We want to know if some of these tips were useful. And the beauty of this is that for other people who may be suffering from acne or may have a situation with acne, there's a lot of jewels in what Rose has provided that you can kind of figure out, okay, what's my next step? Find a dermatologist, partner with someone. And of course, we'll have all of Rose's, information for her practice. If you want to see her, this is not a plug for her. I'm just saying that, we have her on the show. She's talking to you, and we heard she has a pretty good track record with treating acne. Just putting it out there.
But pretty much any board certified dermatologist who is interested should be able to help.
Absolutely. So
anyone that you connect with. So if it's not feasible to see somebody in New York or to see me, don't feel that it has to be me. There's a ton of help out there.
A ton of wonderful men and women that can help you. And not only that, you also have some control on the products that you use.
Yeah.
And so you can
just, follow the tips.
Follow the tips.
It's what I tell my patients when they come into the practice. I send them home with homework.
Oh, I love that.
I do.
Oh, I love some homework.
I'm probably a little annoying, but
they keep coming back.
Yeah, they come back and they're like, oh my goodness, people are complimenting me, or, oh, I don't wear makeup anymore, or
that sounds amazing.
So for me, by the way, can I just speak about being the doctor in this
situation?
Yes,
of course.
It gives me such a high.
Oh, Rose.
I love it. I love when people come back. And I'm big on taking before photographs.
Yes.
Because the first day they come in and they're telling me how horrible it is. And what I'm looking at is the result that they're going to get in my head. I never say this to them, but in my head, I'm seeing beyond what's in front of me. I'm seeing 3 months down the road.
Oh, I love it.
But I take photographs because they don't remember.
They never remember the before, right?
Nope. And 3 months later or 4 months later, when we're doing a follow-up, they're like, no way, that wasn't me.
Who's that?
Who's that?
Who's that? That's not me. Oh, I love what you said about the visions. I think you know this. My name, Damali, means beautiful visions. Huh. And so I feel like I'm always seeing a few months, few years. I'm always seeing down the line. I'm always seeing beautiful visions for everyone.
Amazing.
Absolutely. Weird. So, Rose, I think you are the best, Rose.
We won't
you
start
are the
again.
best. We can start that love fest and keep it going. But what we will do instead is play the next message.
You have one message.
Hi, Damali. This is Regina. Well, my conflict is, actually, I have a boyfriend who is a food lover. Well, in other words, junk food lover. especially because he doesn't really have time to cook at house. He's totally dependent on takeouts. I constantly tell him to eat healthy, but he always shuts me off by saying that life is uncertain and just let me enjoy my food. And how can I convince him to eat better? Because I tried so many times, but each time he always chooses not to listen to me. So how can I get into his head and actually say that eat healthy, eat better? Thank you.
That's interesting.
Yeah.
I mean, that probably affects a lot of people, right?
I know. I'm like trying to pretend that I'm her, and just I can actually see her, trying to constantly have this guy that she's apparently adores.
Yeah.
And he's probably great in every other way, but she's just watching him basically go down this tunnel, just eating junk.
And he has a good point. He's like, life is short. Let me enjoy what I enjoy. And it's like, that's like, how do you combat that? How do you have a rebuttal to that?
Yeah, it's hard. And especially if he doesn't have any medical problems. Like if there's no sign that what he's doing is causing something bad. Does he have a pot belly?
Yeah.
Does he have really bad skin? Does he have heart disease, high blood pressure, diabetes? Something that's showing that if you continue to eat this way, there's not going to be a good outcome.
Yeah.
It's hard to get through to someone when they don't have. So maybe one of the things she could do is, maybe look around the family, look and see what his parents are like and his siblings, if maybe they're showing the signs of what eating poorly can do. Because if he eats like this, chances are that he came from that, right? He grew up with a family where people ate whatever they wanted. This is what was cooked. Well, he's eating his takeout. But maybe looking at the examples around and seeing that, your brother is, only 4 years older than you, and he's got heart disease, or, if there are examples around.
Yeah.
Or looking at their body type and seeing how, he may look hot and cute right now, but give him an example of, listen, look at your brother. He probably, he looked like you 4 years ago, and then he continued to eat this way, and he got these diseases, and now he's not as cute.
Yeah.
Look at that. I made an assumption that he was cute. I have him. He's cute. He's got a flat belly, and he's just eating all this stuff. So it's probably hard to really convince him.
And then his metabolism slowed down, and now he's not as cute and has all these diseases. Poor brother. Poor brothers.
Poor him. I think if there are examples around that you can cite, it would be helpful to your cause. But
that's funny. It reminds me of like Scared Straight, right? You're like, oh, I don't want that to happen, so I'm going to stop. But it's hard. I don't want to go. But what's hard about it too, Rose, is it's hard too when it's someone who you are romantically involved with. And I mean, I don't know if they're romantically involved, but it's not boyfriend. Boyfriend, right? Mm-hmm. And so we're making some assumptions here. But part of it too is like, you want what you think is best for this person. Right. You want them to eat healthy because there are certain things that comes along with the healthy diet. Like maybe you have more sustained energy. Yes. Maybe you live longer, among other things. Mm-hmm. And so part of it is, a little bit of self-interest, right? Because
she wants him to be healthy for her.
That's right. She wants him to be healthy for her. And so like I can respect that. I think I wonder if, because some of it could just be, to Rose's point about exposure, access, precedence, right?
Right.
So I wonder what would happen if you started providing or introducing some other takeout options that may be healthy. I don't know where you are. I think most of our callers are calling from New York. Okay. And so, if you're in a city like New York, or not even, I mean, if you're pretty much anywhere, especially with takeout, there's so many options now. There's so many options for things that you can get. Mm-hmm. There's so many places that promote, grass-fed, locally sourced, organic, et cetera. Yeah. And so maybe it could be something that's just replacing some of the takeout options with things that are equally as delicious, but maybe not with as many, trans fats and things like that.
And if she has the knowledge for her own lifestyle, and she's knowing what to buy for herself, she can share a little of that with him. Maybe, order takeout together.
Yeah.
And just order things that make more sense. And then when he eats it and he realizes, oh my goodness, it's yummy.
Yeah.
And it's still takeout.
And being authentic, not being like, this eggplant is the best. Like I've never heard anyone say that about eggplant, So not like being like, kind of like fake about it, but we're assuming that she knows what healthy eating is too.
Yeah.
And so like, I agree with you, like kind of doing it together. Maybe.
Yeah, I was going to say, or preparing, but we don't want to have her take on that responsibility. He's just the boyfriend, right? He's not the husband. So you have less control over what he eats. But yeah, I think ordering together and you taking control of maybe suggesting where you guys order from and, going down the menu and saying, yeah, I know you love fried chicken, but maybe we could get the grilled chicken prepared with, some Indian spices. I don't know.
That
something.
sounds good.
Right?
That sounds really
I'm
good.
hungry.
I want that. Where can we get that? That sounds delightful. What's interesting too is this would be so funny. What if, I'm not suggesting you do this color, but what if like she was like looking at TV or flipping through a magazine and she's like, oh, this guy is so hot. And it just happens to be like someone who's like really fit eating like a cucumber or.
not the Burger King commercial.
Yeah. I mean, like I'm not suggesting that you try to get someone jealous. I think that's like your boyfriend, but the point is like I think that what Rose and I are saying is that there are a lot of ways to model the behavior that you want to see, also to introduce perhaps some new takeout options, and maybe even explore some new things together. I remember I was at a retreat in California and they had all the food prepared and brought in, so we had no control over what was coming in. And one of the things that we had was so delicious, and it was called what's it called, a fat bomb or something? But basically it was like I don't think it was cooked. I think it was like molasses and coconut flakes and something else. And it was like a little ball and it was so good. I don't even know. I mean, and I think it may have its roots in paleo or keto or something, one of those cool sounding names with vowels at the end.
There are some amazing options for delivery.
Right?
But he probably has to be introduced to it, right?
It's true. And so maybe take a little bit of the initiative. Maybe she's already doing that. Who knows? What's interesting about some of these calls is that we only know what you tell us. And so we're kind of going off of it.
We're making up a whole scenario
Just
here
making
based
this
on
up.
just a few words from you.
Yeah,
so
but-
hopefully we're not going down the wrong road.
Yeah, but I think we're providing a lot of different options for, people to consider if they're facing something similar.
Yeah.
Like modeling the change. I know, for example, when my husband and I were first dating, I thought I was going to make this vegetable lasagna. I never made regular lasagna before. So I don't know. I must have been in love. I don't know what I was thinking trying to make a vegetable lasagna. And yes, I bought an eggplant. No one told me that eggplants, like all this water comes out of eggplants. I didn't even know it was 90% water. It was by far the worst thing I've ever cooked in my life. And this is how I knew I was going to marry him. I made it. There's water coming out of it. It was gross.
Goodness.
And I said, so what'd you think? And he was so diplomatic. He goes, it's not my favorite of the things that you've made. And
Lawyer.
I'm going to marry this guy because if he could eat this and tell me, I would have been like, this is awful, But no, he was like, it's not my favorite. And I'm like, you know what? If he can handle something like that and still be diplomatic and still say something endearing, then we have a future together.
Yeah.
I think we have a future. And so with that being said, I think, caller, you have a lot of tips from Rose and I on some ways to think about approaching this with your boyfriend. And hopefully that's, some things for you to think of, and maybe those ideas. And this is what I want for all of our podcasts. For maybe, even if these ideas are things that you wouldn't do, maybe these ideas will spark other ideas for you, right?
That's great.
Yeah.
Yeah.
And so that's what it's all about.
Realizing there are options, right?
Yeah.
There are things, there are solutions. You may not have been exposed to all of them before, but the hope I'm getting from you, the hope is that just us talking through all this will spark something in her.
And that's what I'm looking for. I mean, kind of like this kind of brainstorming, and you have the creative juices flowing, and so many ideas come to mind. And just don't evaluate them. Just start writing them down, thinking about things you can think of, whatever you can think of. Just maybe set a timer and say, in 2 minutes, what can I think of, right? And let all those ideas flow out, because one idea will beget another idea, will beget another idea. And then all of a sudden you have all these ideas that were before you were stuck. Now you have some options. And that's how you reach your breakthrough.
I have nothing else to say. That was amazing.
Oh, Rose, you are amazing.
Here we go again.
You are amazing, Rose. Rose, it has been an absolute joy to have you on the show today. I mean, just a joy.
This was so easy and wonderful, and it was fun.
Yeah, well, it's
fun.
easy when you do something that you love with people that you admire, right?
Thank you.
And love.
I admire.
Let's just make it. Let's just be.
You
just
know, I
transparent
admire and love you beyond.
Likewise.
And I hope that the information was helpful.
Well, first of all, I'm going to start looking at non-comedogenic things everywhere I go. I'm just going to drop that non-comedogenic everywhere I go.
You're so fancy.
Well, I learned from the best. I learned from the best. Thank you so much for tuning in today. It's been really great having Rose in the studio. Hopefully there's a lot of tips that you can gauge from all the wonderful dialogue that she and I had today. I'm your host, Damali Peterman, and this is Breakthrough Barriers with Damali. Continue to break through and have a wonderful day. Do you have any barriers that we can help you break through? If so, you can leave a brief message at 646-363-6322 or on our interactive blog at www.breakthroughadr.com. Please follow us on Twitter, Facebook, Instagram, and LinkedIn at the @BREAKTHROUGH, capital A, capital D, capital R. I'm your host, Damali Peterman, and this is Breakthrough Barriers with Damali. Although I am a lawyer, mediator, and an educator, and many of my co-hosts will represent various professions, we want to be clear that we are not providing legal advice, counseling, or suggestions. Our goal is to provide a roadmap for conflict resolution to generate future conflict resolvers. Continue to break through and have a wonderful day.